Hi everyone, my name is Martha and today I come to talk to you about a possible way we could improve our quality in our healthcare system. To start off, I would like to ask you a couple of questions, such as how important do you consider communication in our daily lives? Is it done often? Moreover, do you think that communication in a healthcare facility is as important as that of our daily lives? Whatever might be your answers, I hope you just came to the conclusion that communication is important. Communication actually plays a vital role inside a healthcare facility, especially when a patient and an employee are meeting. Now, this same communication becomes a challenge, especially when the patient is of limited English proficiency. Now, the law requires it for any individual who is in need of translators to have access to one in any program or activity that receives federal financial assistance. Our problem today is not that we lack translators, but the fact that healthcare staff are not well informed and therefore fail to inform patients of their options of translators, or better yet, their rights. Now, this becomes a problem because, as a source mentions, there are more than 46 million people in the United States that do not speak English as their primary language, and more than 21 million speak English less than very well. Ultimately, this lack of informing patients of their options leads patients to ultimately feeling uncomfortable, at times unknowledgeable, and other times confused, leading to poor quality visits and misdiagnosis. Now, there's multiple ways we could approach such a conflict that will ultimately lead to great outcomes. Now, as of today, healthcare staff have many options from which they could use when in need of a translator. For example, we have face-to-face translators as well as telephone interpreters, bilingual healthcare staff that could also be used, and family interpreters. Now, all of these options have their pros and cons for using. As an article mentions, face-to-face interpretation is the most desirable. It allows for observation, interpretation of verbal as well as nonverbal. Telephone interpretation, main difficulty is that body language is lost. Now, this statement further supports the idea that all of these options do come with pros and cons. Yes, face-to-face interpreters deliver that body communication, but are oftentimes more difficult to access and are a lot more expensive compared to telephone interpretation, although it loses body language. Now, we also have bilingual healthcare staff, which are healthcare staff within the same department from which the translation is needed. The only bad part about using these kind of interpreters is that they are not professional interpreters, and although they may speak the same language, they are oftentimes not able to translate healthcare terms properly to the patient, and overall have to stop their work in order to take the translating that is being needed. Now, moreover, we also have family interpreters that could also be used, and this could be a positive and a negative thing on the patient, depending on how comfortable they feel with this family member being in the same room in the meeting of the care provider and the patient himself. Oftentimes patients feel comfortable and feel like they could rely on a specific person as a reminder, and other times they feel like it's a personal issue and it should be discussed with professional individuals. The positive side about this is that they are close to the patients and they are free for the healthcare facility. Overall, all of these options are currently being used in the healthcare field when patients are of limited English proficiency. Now, today, the problem is not the lack of options of translators, but better yet, the lack of knowledge from both patients and staff. Now, as an article states, despite the federal right to language access for LEP, patients in healthcare setting, the reality is that many healthcare providers are not aware of their responsibility, have not prioritized the issue, or have not been held accountable through consistent enforcement of these laws. This, moreover, states that either patients are not informed, and if they are informed, they are not putting it into practice because it is not being enforced enough inside the healthcare facility. Meaning that ultimately the people who are most affected are the patients who do not speak English properly. Now, by not informing patients of their options, you could observe some dissatisfaction, as well as another article informs, when a person is not able to communicate or lacks words of expression for his or her desires, there is an obvious risk of misdiagnosis, which could lead to inappropriate treatment. Moreover, this statement supports the idea that translators are important, and that in fact, to better encourage satisfaction in patients of their care, and better improve the quality in our healthcare system, and better yet, reduce misdiagnosis and offer the proper treatment, translators are of deep need. In conclusion, the solution to such a problem is not in advancing our methods of translators, because there are already so many from which staff could pick from. The solution is ultimately in the hands of staff. Staff should take courses if needed to better understand when and how to access translators, and how to better yet inform patients of their options and their rights. Moreover, the healthcare facility should encourage their healthcare staff to put into practice their learnings and to make accessible translators to patients. Another solution to such a problem could be the use of more advertisement within the healthcare facility, to let the patients know the moment they walk into the facility that location is offering translators to them, and that it is their options, and that it is their right. Ultimately, all of these methods could ultimately lead to better patient satisfaction, decrease in misdiagnosis, and better yet, improve the overall quality in our healthcare system.